In your health news tonight, a topic that women know all too well, cellulite, and it is swimsuit season. So Dr. Mitchell Goldman is here not only to talk about treatments and what works and what doesn't, but also some that are downright dangerous. Dr. G, thanks for being here.
Yeah, always good to be here.
All right, my first question is cellulite just a cosmetic problem, or is it a signal that something else might be going on health-wise?
Well, cellulite is a normal female characteristic. About 90% of women have cellulite, and the other 10% think they do. So, and basically, it can happen in anyone. It can happen in people that are overweight, or it can happen in people like our alumnus that are very healthy. And what it is cellulite's a way for females to actually store fat so that when they're pregnant or when they're breastfeeding, they have enough energy in order to supply breast milk and to grow a baby.
So that's why men don't get it necessarily and women are more susceptible, but why are some women more inclined to get it than others?
Well, it is about obesity and lack of exercise. So what happens is as we get older, the cellulite, which is basically honeycombs of fat underneath the skin, those honeycombs become a little bit more hardened, and then the fat has nowhere to go but up, and that's why you see this dimpling appearance. Where men don't have the honeycomb storage, instead men store their fat in sort of like parallel lines, so we just get regular fat, but women get fat with like little bumps, which is essentially the cellulite.
All right, well, let's talk about treatments now, because you can't necessarily just exercise this away, although that would help, correct?
Yes, the leaner you are, the less fat, the less cellulite.
So what are some of the treatments then? I mean, I've heard everything from rubbing coffee grounds on your thighs.
I know. There's so many treatments. Treatments with caffeine or aminophylline, the topical cellulite creams, they can actually be a little dangerous because you can get reactions to those creams and you can be dehydrated. Mesotherapy is injecting a wide variety of different chemicals into the fat to try to get the fat to dissolve. But again, if you do it too much or with the wrong chemicals, that can actually cause what's called a volume switch, and you can actually lose blood pressure. Massage and spa treatments are actually pretty easy to do, and they feel really good, and you look great for about an hour or two after the massage or spa treatments, and then the cellulite comes back. So the last two treatments which we saw are where we're actually using a surgical way to cut those little honeycombs to allow the fat to be more uniformly spread, and a brand new treatment where we're actually injecting a medicine called collagenase into the little fibrous bands to allow them to sort of soften. And those are the two treatments that actually do work, and when you have a treatment done, the results last at least for 5 years.
And real quickly, because we're out of time, but it's that mesotherapy that if done incorrectly, the chemical interactions that could be harmful?
Yes, it really is, because oftentimes you don't know what chemicals are being injected, and you can actually drop your blood pressure. You can also get infections, and so mesotherapy is not something that's approved in the United States, nor is it anything I would recommend people to do.
All right, we'll sure to put a red flag next to that one. Dr. G, thank you so much for your time on this Tuesday.
Good to be here.